going to verify the order and make sure I have the correct supplies. So I have clean gloves, a dressing change training kit with the sterile gloves in it, the bio patch, a mask for my patient, and then some wipes to disinfect the table. So first I'm going to wash my hands. Okay. Hi, I'm Helen. I'm your student nurse and I'll be helping your nurse for today. How are you feeling?
I'm good.
Good. And do you have any pain right now?
Not right now.
That's perfect. So right now I'm just here to change your central venous catheter dressing. And from the looks of it, it looks pretty dry, clean, and intact. But it has been 7 days, so I'm just gonna change it so it stays clean and dry. And because it's been a while, it might be a little sticky. And so when we do get to that point of where I take it off, just let me know if you have any discomfort, okay?
Okay.
Okay, and this is a sterile procedure, so I am gonna ask you to wear a mask. Here you go. And when time does come, if you could just face your head away from the entry point, okay?
Okay.
Okay, so can I have your wrist, please? All right, and can you tell me your full name and date of birth?
My name is Ray Henson, and I was born on June 15, 2000.
Okay, perfect. And do you have any known allergies, specifically to chlorhexidine?
No, not that I know of.
Okay, and I checked your chart earlier, and it said that you didn't have any allergies either, so that works out. So now I am going to disinfect the table with the chlorhexidine wipes. I'm going to do it for 30 seconds. I'm going to throw it away. And then I'm going to wait 2 minutes. And then I'm going to go wash my hands again. And then I'm going to grab my clean gloves. And then I'm going to open the dressing change kit while preserving as much sterility as possible. I'm just going to tuck it under and making sure everything stays in the sterile field. And then I'm going to carefully take out the sterile gloves right here, and I'm gonna drop the bio patch in. Perfect. Is this position comfortable for you, Ray?
Yeah.
Good, okay. And now first, could you please turn your head away now?
Okay.
Perfect. I'm just gonna measure this really quickly. So it's like maybe like a couple inches, 2 inches. I'm just doing that to make sure the tubing length is the same before and after I take off the dressing. And I also want to make sure the catheter, the tubing is clamped, because if the ports are open to open air, then like there could be blood loss or air embolisms. And I also want to make sure that it doesn't disconnect. And if it does disconnect, then I would immediately clamp it and I would clean the open tubing ends with alcohol and let it air dry, and then I'll replace the injection ports or the tubing itself. Okay?
Okay.
Okay, now I'm going to stabilize the tubing. And then I'm going to make sure to remove the tegaderm very slowly. And I'm going to lift it up from the edges all over the sides. Do you have any discomfort?
No, I'm okay.
Okay, perfect. I'm going to remove everything. Throw this away. I'm also going to take this off the tape. Okay. And I'm also also gonna assess your site to make sure there's no any signs of infection, which I don't think you have because there's no signs of redness, swelling, or discharge. I'm also making sure the clamps are closed, the connection is intact, and then you have caps on. Perfect. So I'm gonna take these gloves off. I'm gonna wash my hands again. And then I'm gonna open my sterile gloves. Lift it up. This. I want to make sure I stay in the sterile field. Perfect. And then I'm going to lift this up. Okay, I'm going to pinch it from the middle and then move it up. And I am going to grab the Tegaderm. I'm going to open it just a little, just so when time comes and I need it, it'll be halfway open. And now I'm going to grab the CHG and I'm going to crack it, okay? And I'm going to use this hand to hold your tubing. And I'm going to go in a window technique where I will start from the inside and go to the out. And I'm going to do this on all four sides for 30 seconds, okay? And now I'm going to clean the tubing. So I'm going to go from base up, base up, base up, and base up. Okay, so we're going to put this away. Now because it is clean now, I'm going to take your bio patch and I am going to slip it on. Make sure it's clean and stable. Perfect. And then I'm going to grab the Tegaderm. And when I do put it on, I'm going to make sure that there is 2-inch distance from the middle. And also make sure that there are no air bubbles or any folds. Okay, perfect. Secure it down. And then I'm gonna now take off the excess stickers on the side. Okay, and then I am going to write my initials, the date, and the time I replaced it. And then next I am going to get tape and I am going to secure the excess tubing so it's not in the way. Okay, perfect. Now I am done and I want to know, how did that go for you?
That was good.
Wasn't it too uncomfortable?
No, it was good.
Perfect. And do you need anything else?
I'm okay for now.
Okay, and when you do need something, just let me know and just call the call button and I'll be here as soon as possible, okay?
Okay, thank you.
Of course. And then now I'm just gonna throw everything away. And now I'm gonna take off my gloves, throw that away. I'm gonna wash my hands and I'm gonna go and document the Cvad dressing change.